How much money do you make as a CRNA?
Hey, what's up guys, welcome back to my channel. My name is Lori. If you are new here, I am a family nurse practitioner, and today I have a special guest. I told you guys on my last video that I did from I think a week ago. I posted it. It was titled CRNA versus nurse practitioner and why I chose to become a nurse practitioner, that I would have my girlfriend Latanya come on and talk more about the CRNA role. Say hello.
Hi everybody.
So this is my girlfriend Latanya. She's my friend. I didn't just pick up a random CRNA to come do this video with me. Latanya, actually, I think I said on my channel that I was a new grad in the ICU, and she is the one that actually told me to apply to the ICU because she was working in the ICU. We worked together on step down when I was a CNA.
Yes.
And she was a nurse. So we're gonna get into a couple of these questions that I got from you guys about the CRNA role versus the nurse practitioner role, and hopefully this will answer a lot of your questions that you guys have. Did you always know you wanted to be a CRNA?
I knew I wanted to be a CRNA my senior year of nursing in undergrad. As part of that semester, we had to observe in the operating room for a day, and I was supposed to be with a circulating nurse following her around for 8 hours, but I actually end up in the corner with the CRNA, like hovering over them, asking them questions about their machine. So that's when I kind of knew that my interest was in nurse anesthesia, and so that's kind of where it all began.
That is amazing. So how long have you been a nurse?
Prior to going back to school for my master's, I did 6 years of nursing experience. 3 years on a step down intermediate floor, and then 3 years in the med surg ICU.
For CRNA program, we do know that everyone need 1 year of ICU experience to get in, but one of the things that people were saying is the CCRN required or just boost your chances of getting in?
Now that will vary according to whichever school you apply to. So some programs require it, some programs do not. So I didn't
know that.
Yeah.
I honestly didn't know that.
The requirements changed. For the school I attended, it was not required, but I did have it to, right, as you said, boost my chances of getting in. You want to do things that are just gonna kind of make you stand out and stand like one cut above the rest.
Right.
So
it is so competitive to get into these programs. Why do you think it's so competitive to get into the program?
It is very competitive because there are a limited number of seats per program. The program I attended, I believe there were only 25 seats, and there were over 300 applicants. Everybody's just fighting for those seats.
Yeah.
And I mean, the limited number of seats are based upon the number of clinical sites that are available. So that can severely reduce the number of spots available.
I didn't know any of this. See, this is why I get experts to come and share their knowledge. Share their knowledge on the programs and what they're doing. So another question was, what is the day-to-day job role?
I would say first and foremost, we are patient advocates. Most of the time our patients are asleep and cannot speak for themselves, so therefore we have to be their voice.
Nurses first.
Nurses first before anything else.
Nurses first.
Again, the role will vary based on which institution you work for. At some facilities, we are supervised by an anesthesiologist, and other facilities are CRNA only practices, meaning that there are no anesthesiologists in the building. You are the only person there.
Can you do that in Michigan?
Yes, in kind of out in the country areas.
Oh.
Yeah, yep, Hillsdale, Michigan, for example. Even if there are anesthesiologists involved, sometimes CRNAs are required to do their own pre-op evaluations, meaning that they assess the patients preoperatively and are responsible for documenting that.
That's in the hospital or the privately CRNA only facility?
Both.
Oh,
yeah,
okay.
Both.
Okay.
Either one, yeah.
Okay.
Yeah. Either way, the CRNA, before you take the patient back, you are going to ask those pertinent questions to your patient yourself because you want to hear, so to speak, directly from the patient.
Yeah, for sure.
Cut out the middleman. So we evaluate them preoperatively. Back in the procedure area or operating room, we provide the anesthesia. So that could require a breathing tube in which we intubate the patient, place the breathing tube into the patient. It could be a monitor anesthesia care case where it's sedation and you just provide oxygen through a nasal cannula or a mask. But during that intraoperative period, we're monitoring the patient, we're treating the patient, we're titrating our anesthetics and medications as needed. Any hemodynamic changes that may occur, you know, whether it's low blood pressure, high blood pressure, administering IV fluids, keep the patient hydrated, and we are giving emergency medications if it comes to that.
It's not just intubating.
It's not just intubating. It's not just putting a tube in or reading a book or newspaper, as you see on Grey's Anatomy or hear about in the world.
It's such a wide range of things that's going on that make for a busy day.
It does. It can make for a busy day, a stressful day, but most of all, a rewarding day.
That's
because
amazing.
The best feeling is to allow a patient to get through their procedure or surgery comfortably. And they wake up, and the best part is it done yet? And it's like, yeah. Or when are we getting started? It's like, it's done. You know? And then some other roles, real quick. And again, these will vary based on the institution you work for, but placing arterial lines, central lines, nerve blocks for pain management.
Does your hospital do that? Do you guys do that?
Not the A lines or the central lines.
That's a lot. Yeah. That's a lot. So mostly it's work in hospital. You can work outpatient at different surgery centers. Where else? That's pretty much it.
Yes.
Where you can work.
Of course, there's little private practices for cosmetic surgeries.
You can be the CRNA in my practice when I open it up.
Yes,
honey.
Yes.
So the next question that I got was, how was the program? Was the program difficult? We already talked about it being competitive to get in because of the limited amount of seating. How did you find the difficulty? And she's smart. Overall, did you find it way more difficult than nursing school per se, or is just more information?
It's definitely a lot more information, and it's very demanding and time consuming. They recommend that you do not work. There are some programs that will not allow you to work, and then there are others that are more flexible and will allow you to work.
So what does that mean? Is it true that you have to sign a contract that says you can't work? Is that true?
That will vary depending on the school you go to.
Oh, so it can be true.
It can be true.
Okay. Okay.
It can be true. But the program is very demanding. It requires a lot of discipline, a lot of, good time management skills. As far as comparing it to undergrad nursing school, it was definitely more challenging. However, I used the same technique that I used in undergrad, in that I learned the professor's styles of asking questions on tests, and that helped me tailor the way that I studied. They're like very, very content specific. Then you study the content, and if it's more clinical, like, if this were the situation,
that's a good advice.
So definitely
that is a great advice.
That helped me, and therefore, some people find with most programs it's heavy in the didactic or classroom first, and then less clinical at the beginning, and then you increase the clinical and fall off on the didactic as the program goes along. But overall, it was challenging. It was challenging. You have to have tough skin. It involves going to clinicals, and there are very, very different personalities that you may encounter. As with undergrad nursing, you find some people who are not as nice as we want them to be.
So clinicals, when we went undergrad, we went there with a group of students, and we had a clinical instructor. Is it the same, or you just go to the facility and it's you and you're working with a CRNA that's working in that building? How does that work?
You get assigned to a clinical site for usually 1 month rotation, and there's not a clinical instructor with you.
Okay.
So it can be just you as the sole student, or it could be like 2 or 3 of you from your school or class. Like, you can be in different years of the program.
Okay,
it could be like your first year clinical and the second year, like a junior, senior, we call them, at a clinical site. Sometimes you meet students from other programs, which is really nice because you get to talk to them about the differences in the programs, or just different techniques and ways of doing things.
The next question is, what are your tips of kind of boosting your chances to get into the program?
Okay. I would say first and foremost, job shadow. Job shadow more than once to make sure that it is the correct fit for you. Also mention that in the interview. You want to do things that make you shine as a nurse. That means partaking in the charge role, getting involved in committees. But you just want to kind of make yourself more marketable. If you don't get involved in a committee at your hospital or facility, you can be involved in a committee at the like state level, like a state organization. And also, if you get an interview, practice your interview skills and also dress for success.
Let's talk about the interview process.
Yes.
Because that is another question and very
Okay.
scary for some people.
Yeah.
Once you go to the interview process, do you have a panel of how many people interviewed you for the program?
Oh my gosh. I think maybe 4 or 5.
What did they ask you? One question. Can you remember?
Oh my god. What is the antidote of heparin?
They're asking you like medical type questions.
Sometimes it can be medical, sometimes it can be clinical, sometimes it's just getting to know you as a person. Like, what are your hobbies? They want to know if you keep up with current events, like in the media, so they can ask you questions about like news stories or senators or whatever it could be. Part of that is to see how you respond under pressure. Like, are you going to fib your way through the answer, or are you going to be upfront and say that you don't know and you'll get back to them?
One of the questions I also got was, does the grades from your undergrad classes matter when you are applying for the CRNA program?
Yes. They definitely do. They require, again, it's going to vary per program, but they usually require I want to say a B or better core classes, like your
Patho.
organic chem, patho.
Yeah.
Some require statistics. Some even require a grad level statistics course, which you would have to take somewhere if you don't have it. Well, the program that I attended, those classes had to be within 10 years. Or else you had to retake them
the class
in order to apply.
So one of the questions is, can CRNAs write prescription? Do you have a DEA number?
I do not have a DEA number. CRNAs are not allowed to prescribe medications for patients. However, with that being said, in the operating room or whichever site that we're administering anesthesia, we are not required to obtain a physician's order in order to give medication. So we can give whatever we want, treat the patient however we need to treat to get the job done. We are not allowed to write prescriptions for patients or anybody.
If you're a nurse practitioner, we do get what's called a DEA number. I think I talked about this once before. So we obtain a DEA number, and that allows us to write prescription because we have the authority to prescribe medication for patients. The next question, the biggest question of all, how much money do you make as a CRNA? You ain't gotta answer that. We're not trying to put her business out there. Is the pay competitive? Yes or no? Is the pay competitive?
Yes.
Of course the pay is competitive.
Yes. But yeah, I will say we are compensated well for the amount of, for the different situations that we can encounter on a daily basis. It can be an emotional, stressful, and straining job, especially when you give your all to a patient, and if things don't work out, if medications and things don't play out the way that we hope they do, that takes a toll on you emotionally. You know, it's a lot of responsibility. At the end of the day, we have patients' lives in our hands.
Exactly.
You do as well.
And then you have patients varies in different ages that go under anesthesia. Like you know, think about it. Not only grown adults go on, have anesthesia. You have kids that have anesthesia. So that is it, guys. I hope I have answered as many of the questions that I did get. I did get a lot of DMs and questions over on my Instagram account. If you are not following me over on my Instagram, please do so. It is the same handle, from CNA to NP. And I do want to thank my girl Latanya for coming by. She even drove to my house. And I offered to come to her house with all the equipment. She said, no, that's fine. So thank you
for having me.
Oh, thank you for coming.
For watching.
Don't forget to like, comment, and subscribe. And I will definitely catch you guys on my next one. Bye, guys.
Bye.